This episode of the Nurse Practitioner Podcast is sponsored by Dakin's. When you're treating persistent, hard-to-heal, or complex wounds, you need a solution you can trust, like Dakin's Wound Cleanser. Just how powerful is it? Dakin's Wound Cleanser has been proven to kill even highly resistant bacteria like MRSA and VRE within only 30 seconds. It's non-cytotoxic, shelf-stable for 2 years, and more cost-effective than other wound cleanser brands. When you need a solution you can count on, ask for Dakin's.
In this episode of the Nurse Practitioner Podcast, Louise Kaplan, Johanna Stiesmeyer, Mykell Barnacle, and Gregory Rys discuss nurse practitioner residencies and fellowships in rural communities. Thanks for joining us on today's episode.
Thank you for the introduction. I'm Louise Kaplan, and I'd like to give a brief overview of a project that was conducted by myself and colleagues, Susan Skillman, Samantha Pollock, Davis Patterson, who are all investigators, are with the Rural PrEP program, which is the Rural Primary Care Research, Education, and Practice Collaborative. And this project was funded by HRSA, the Health Resources and Services Administration. And I want to provide a disclaimer that any information, conclusions, or opinions expressed in my presentation are those of the authors and have no endorsement by HRSA or any other government agency. What I'd like to start with is a mention of the fact that nurse practitioners are very important to the provision of rural primary care. National data indicates that nurse practitioners account for 24.6% of all rural primary care providers in micropolitan and non-core counties. Consequently, these are the rural providers. In terms of the study that we conducted through Rural PrEP, our purpose was to systematically investigate rural and rural-serving postgraduate residencies and fellowship programs to understand whether and how they facilitate successful transition of nurse practitioners to rural primary care. And I will hereafter refer to these programs as residencies. What we know about nurse practitioner rural practice is limited regarding factors that encourage nurse practitioners to choose rural practice. We do understand from research that loan repayment and rural residence prior to becoming a nurse practitioner influence the initial decision to choose rural practice, and that rural connectedness or satisfaction with the community, having a mentor and supportive work environment, and salary and benefits, as well as loan repayment and rural residence, are vital to retention. And I do want to just mention the terms both residency and fellowship refer to postgraduate training. There is a national debate about which term to use, and as I stated, this presentation will use residency. In our study, we identified 20 rural nurse practitioner residency programs, some of which are HRSA funded, most of which were only in their first or second year post-implementation. For our project, we interviewed nurse practitioner residency program directors and project managers, clinic administrators, and current and graduate nurse practitioner residents with a total of 24 interviews completed. What we identified was that goals of the residency programs were primarily to have the nurse practitioner residents stay in the clinic after the residency program, which we refer to as workforce-driven, or to have nurse practitioners remain in rural and/or primary care practice, which we refer to as mission-driven. Some of the residents identified for us their personal goals in choosing the rural residencies. These included the ability to increase their confidence in clinical competencies, to gain a year of experience to be competitive in a tight job market, the likelihood of a job at the end of the program, eligibility for loan repayment, and for some, the desire to work and live in a rural community was overarching. The characteristics of the programs that we identified include the fact that most of them had what's referred to as continuity clinic, where the nurse practitioner residents developed their patient panel with preceptors there to support and guide them, and to have a slow ramp up in their patient load. The programs also offered mentored specialty clinics to gain specific skills or to work with specific populations, such as suturing skills or to work with pediatric patients. Some of the programs offer training for Suboxone treatment for opioid use disorder. They all include some didactic content, meetings with residents and mentors on a regular basis. Some include reflective journaling or journal clubs, and the range of salary that was offered differed among the programs from about 2/3 to 100% of the standard NP salary. Because the programs were new, only 1 to 2 years, there was limited retention data, and the number of applicants varied by year. There seemed to be more applicants where limited nurse practitioner jobs were available. And there was also no consequence of leaving the program because the nurse practitioner residents are actual employees. What we identified overall was that there are a limited number of nurse practitioners who have completed a residency, making it difficult to draw conclusions. And that curricula among the programs varies greatly, limiting the ability to assess the effectiveness for rural practice preparation. We're wondering, as researchers, is just practicing in a rural community enough to retain nurse practitioners in rural practice? We're wondering also, since loan repayment is an important factor that influences nurse practitioners to work in rural practice, and that connectedness with community facilitates working in a rural community, would those two factors concurrently increase the likelihood of retention of the nurse practitioner residents? So while it's premature to conclude that nurse practitioner residencies facilitate transition to rural practice and retention in rural communities, rural NP residencies are an option to promote recruitment and retention, with further study needed to determine long-term contributions. And with that, I'd like to bring in my colleagues who are with us today to discuss their experience in developing, implementing, and managing rural nurse practitioner residencies. I will be asking a series of questions of my colleagues, and the first one is, could you please tell us how you created your program model, including gaining support with key stakeholders? And I'm going to ask Johanna if she would like to start with her response.
It is my pleasure to go ahead and start the responses. You know, this was an excellent opportunity. Since I am based in New Mexico, we have large rural communities, and the ability to be able to start a program that will bring nurse practitioners, and we also added certified nurse midwives to our program, was highly sought after and supported by our executive leadership. Our rural clinics were also highly on board with this and were cooperative, and we looked at, who would be the best preceptors, and to support what this transition to a rural community practice would look like. Additionally, because we are a healthcare system and not attached to a university, one of our wonderful partners is the University of New Mexico Department of Nursing. And so we paired up with them to be able to help us to construct a very extensive rurally based curriculum so that we could bring in those essential components for both our nurse practitioners and our certified nurse midwives. Also for the selection of UNM was because many of their clinicals and the focus of their programs are in rural communities. So it was an excellent partnership.
Thank you. Greg, would you like to tell us about your experience with the Bassett program?
Sure. Our program model was based on the Community Health Center and Weizmann Institute model of NP residency programs, and then modified for rural settings. We were also lucky that this program was partially funded through the HRSA grant, and that the first year was dedicated to building the program. Like Johanna, we were a health center, so we had reached out to some academic partners that we had worked with before, and we are partnered now with 4 academic partners, 3 SUNY schools that are located around our facility, and Columbia University from New York City, which had a former affiliation with us. But again, mainly like Johanna, our goal was doing with the academic partners were to help build our didactic program in a rural sense so that we were getting rural content for these residents.
Thank you. And Mykell, what's your experience been in North Dakota?
Yes, well, being from North Dakota, rural is always very much part of our mission, preparing our graduates to be good rural practitioners that, kind of hit the floor running has really been part of our focus as a NP program. I'm one of the academic institutions represented here. So, when the opportunity to kind of expand that focus to new graduates arose, we recognized it as a really important kind of next step in better preparing nurse practitioners for that really challenging rural practice, especially coming out of school as a new graduate. Our practice partner already had a really successful transition to practice program and a large rural footprint. And so we knew that, the combination of those two things were a good jumping off point and made them a really great partner for us to try to build something that would be beneficial for the new graduates in the region and the rural residents.
I'd like to follow up with a question about the rural content in your didactic component of the residency. Can you tell us how that content is focused? Johanna, you mentioned your partnership with the University of New Mexico. So how about telling us a little bit about the didactic?
Absolutely. Because we have both family nurse practitioners and our certified nurse midwives, what we did and what our approach was to create topics that were common to both areas of practice. So we were looking at obesity, nutrition, the management of opioids, mental health, and we integrated general concepts into both of those curricula, as well as the specific contents of addressing health disparities that we see here in our rural communities in New Mexico and are certainly very common across the nation. So that was it took us a while to really define what that content looked like, how we were going to deliver it, and the focus to make sure that we were really being able to address the health disparities. One of the challenges with the certified nurse midwife is that there were no other curriculums to compare to. We in another organization were really one of the first in the nation to create this curricula. So it was a challenge, but it has worked out really well.
Thank you. Greg, how did you approach the rural content in didactic?
Very similar to Johanna. Again, though, like she said, there wasn't a lot of curricula to compare to, even with family nurse practitioners. So, we looked at disparities of health in rural settings in general, and then focused on our locations, while also our case-based studies that we bring to our didactics. We bring in demographics, looking at things like planting and harvesting times for the patients that we see, lack of internet, transportation issues, lack of available specialists in the area. And these all become a part of when we are bringing in issues like obesity and diabetes, and even labs and reasons why people don't get their labs. And so all that becomes part of our teaching and our didactics, and bringing in just the rural aspects of everything in each and every part of our program.
Thank you. And Mykell?
This is actually something that we had studied as a faculty group because we were looking for a way to provide a benefit to our rural preceptors in the form of some low cost or free education that could be provided from the academic standpoint. And so we had done a fair amount of surveying our rural preceptors to determine what some additional educational needs would be for them. And so certainly, as both Johanna and Greg mentioned, the rural disparities and chronic disease and social determinants and other barriers that can impact access to care were discussed and are discussed quite a bit in the residency. But we heard from many rural preceptors that procedures were a big area of need. And so we have really tried to add in a good amount of procedural training, which of course is a satisfier for both the nurse practitioner as well as the patient and the facility. And so that has been, a really important part of our didactic training or didactic aspect.
Thank you. I mentioned earlier that Rural Prep was funded for our project by HRSA, the Health Resources and Services Administration, and that many of the rural programs have HRSA grants. All 3 of your programs do. When the grants are no longer awarded, and there may or may not be renewals in the future, have you all considered plans for sustainability of your residencies? And I think, Mykell, why don't we start with you and what you've been thinking about to ensure the sustainability of the program?
Yeah, so our program is actually structured a little bit different. The residents are all employees of the practice partner, and they are hired into positions that they are intended to stay in. And so the residencies actually become available in clinics that are high need, either due to difficulty with recruitment or retention. So when a new graduate is hired into a clinic that has been deemed suitable for a residency, they start building their patient panel right away, albeit they have a lower patient load and lower daily visits, and their productivity goals are not as high, but they are billing and producing revenue from the very beginning, even during the time that they are in residencies. And then, of course, part of the focus is on retention. And we all know that retention is an excellent way to make the balance sheets work a little bit better. And so our hope and belief is that with good support in that first year post-graduation, there will be increased retention and productivity.
Greg, how is your program being designed for sustainability?
Well, our program is also designed that the residents are employees. They are only employees for a year. They are a yearly contract, but our mentored weekly clinics that they go to are usually set up at those clinics that need employees the most, so that they can start to get a sense of where they might be placed if they decide to stay at our health centers. Also, we are in our 3rd cohort of residents, and we have those other 2 resident outcomes right now showing abilities, the graduates' abilities to achieve higher rates of productivity sooner than new graduates hired, which has been really helpful in promoting the sustainability of our program.
Johanna, what is Presbyterian Health focused on to ensure the sustainability of the program?
Yes, absolutely. Very similar to what Greg has presented. Our residents are hired in for a year, and they're placed in clinics that are highly motivated to work with these individuals and would love to retain them if they have positions open. If not, at the end of the year, we're looking to put them into other open position in our rural communities across the state. Additionally, one of the things that we started last year is creating a sustainable internal program that really expands across the whole state. And we did a pilot last year, and it turned out really well. We focused on the same type of content and also taking panels, increasing productivity. And this was very, very well received by our executive leadership and the folks in the clinic settings, as well as those who participated as well. And this year we have started the sustainment program. So as the HRSA grant goes away in another year or so, then we'll already have a powerful program that is concurrently going, and it'll be a seamless transition.
Thank you. And in your comments, Greg, you touched a little bit on retention. And it would be helpful for our listeners to hear from each of you a little bit about your recruitment efforts and a little bit more about retention. And I'm curious if you have any long-term follow-up plans for evaluating where the residents stay, if they're in your system or if they stay in rural communities. So, Greg, why don't we start with you on this question?
Sure. So we recruit through our academic partners, other local nurse practitioner schools. We do lunch and learns. Since COVID started, they've been mainly Zoom meetings. We're also on LinkedIn and Indeed and the AANP website. We did set up our rubric for our interviews so that a lot of our questions are mainly based on people who have a desire to stay or who live or have a desire to stay in rural settings. And we do kind of grade a little bit heavy along those sides. Our program offers training in Suboxone, which also helps for people graduating from our residency program if they stay in rural settings to get loan forgiveness, which helps in retention. This year, we have found that applications have been a little bit decreased. We found that that seems to be a nationwide trend, and we're not sure if that's due to a increase in open jobs from COVID or possibly increase in pay for travel nursing, but there's been a trend in that, and that's currently being tracked. But in regards to tracking the residents, we have a plan to track them 5 years out from our residency program to see if they stay in the rural settings. So yes, we are tracking them. Currently, our residents have all stayed in rural settings so far, but again, we've only had 2 cohorts, so it's early yet.
It's wonderful that you're doing that kind of tracking. Mykell, how is your program focusing on recruitment, retention, and follow-up?
Yeah, so as I discussed, recruitment is a little bit different because instead of recruiting individuals, we're recruiting clinics that we are interested in providing some extra support for. And so it has been a little bit different. And I would agree with Greg that this last year, we've just seen a little bit of a change. In fact, we had 2 residents resign, which is the first time that that's happened. And in both situations, it was pretty evident that with the job market, with COVID, that the rural clinics that they started working at were not kind of their ideal job. And so when a job closer to home or where their family was became available, they took that opportunity. So it has been a little bit more challenging, and we are also kind of eager to see what kind of a long-term impact that has. But besides those 2 situations, we are also tracking long-term who is staying in rural areas. And so far, all of our residents are staying employed by our partner and in their rural clinics. And so, yeah, I think, it's a very moving situation. We will see what happens with the job market and applications, both for NP programs, which I think has changed a little bit over the last year or 2, and I'm seeing that quite a bit, as well as residency programs. So blame it on COVID, just like everything, right?
Well, we'll see in another 5 years whether it really was COVID or not, right?
Yeah. Yes.
Johanna, how has Presbyterian been working on recruitment, retention, and follow-up?
Yes, it's very similar to what my colleagues have already presented. I mean, we do extensive advertising to recruit folks to our program. We have clinical rotations within New Mexico, so that affords us the ability to recruit from those who are in their academic programs. We also meet with folks and our academic partners across the state and really nationally who come here to New Mexico. So we also have a website that talks about our program, which has been great. So recruitment has been a lot of fun. We have rubrics that we use as well to determine who may be the best fit to come here to New Mexico or to stay within New Mexico, depending on their goals and their interests. So that has been very helpful in that situation. When it comes to really monitoring the impact of our program, we have a very extensive return on investment strategy that we use. That includes retention and looking at, how many people, first of all, finish the program. And we've had a few folks who have left. They have been out of state, they were homesick, or maybe this wasn't really what they thought it was going to be, so that's understandable. Those who have finished our program have gone to rural communities and are still there. We do have a very extensive tracking process as well, so that's been very important. Also, to just call out, we've also seen a decrease in applications to our program. Once again, why is that? Whether there's just less applicants out there, or is there more immediate jobs in their communities that they're applying for? I think overall, we see the folks that we interview very, very interested in this transition program. So I think, overall it's an attractor to us, but I think we've been able to hire for all of our position in our last cohort. So that's exciting, but certainly a challenge.
So another point that I'd just like to make, because many of our listeners are nurse practitioners and some are going to be nurse practitioner students who are particularly interested in the program. I know most of the programs that we identified were willing to take applications from nurse practitioners who had 12, even up to 18 months of experience. So this may be an opportunity for people who already have had some work experience. And that leads me to a question that I would really value hearing from all of you in terms of what do you believe is the value of a nurse practitioner residency program for the nurse practitioner, for the clinic, the health system, and the community? So, Johanna, how about we start with you on that?
Sure. I think, and I've heard this from the applicants as well as, certainly from those who have some experience out there. When they come to the program, it is a matter of they are well trained in their basic understanding of this new profession to them. What is the challenge and what these residencies provide as a safety net is the ability to have a slower ramp up to productivity. They can learn and take time to really understand the billing and coding, the interactions with patients. All of those workflows can be quite challenging if you've not had that experience. And whether they have had probably some time out of their program, even a year out, that gap in the ability to hit the floor running and to be highly productive is a difficult transition. So these programs really help to build bring what they need to be highly productive in a very safe environment.
Greg, what would you like to comment on in terms of the value of the programs?
I would say that everything that Johanna said about the residents and what they get from the program. And then I would also add that the clinics, too, they get improved job satisfaction because the healthcare providers and support staff are able to participate in educational process with the residents. And I think it also leads to global health of the communities that we serve because it does expand quality health and wellness services access to that with these residents. But definitely everything else that Johanna added, I'm hearing from the residents.
And Mykell, your perspective on this?
Yeah, I absolutely agree that the intention, and so far what we're seeing is that that enhanced confidence and productivity. I mean, that's the hard number, right? But the confidence is also really important. And I think that is improved with some support. Some of the most highly rated activities that we have throughout our residency actually are not even like the, hard-hitting didactic days where we dig deep or the, 2-day procedural trainings or things that we would expect would be, those are certainly well received also, but residents comment again and again on the value of getting to do specialty rotations within their institution as a really important part of the residency. They develop a network. Honestly, if they're one of the only providers in a rural clinic or one of two, that lack of a support system and network becomes really difficult when they have not had the chance to meet anyone within their institution, or maybe they're new to the community. And so many comment on how important that relationship building with specialty providers has been in their region, that they feel like they have someone that they can send a message to or call up if they have a question. And then the other aspect that, has really been talked about again and again with our past residents is the benefit of journal club and reflective conversations that we have. And, when I think about what it is about those activities that feel important to the resident, it honestly, I think, just boils down to feeling supported by peers and colleagues in a really safe environment. Sometimes they just need to talk about a difficult patient or a, kind of passive aggressive note that they got from a specialist, or when they sent a patient on, or whatever it is, or just talk through, how do you handle it when situations, and that seems to be, that added support that first year, it just is really helpful, I think. So not even necessarily like, did your knowledge of this item increase, but we do need to find a way to support, especially if they're in an isolated setting, in a rural setting where there aren't that many people to reach out to on a regular basis.
Well, thank you all so much for your contributions to rural practice, to rural nurse practitioner residency programs, and for sharing with our listeners today all of the work that you have done to make nurse practitioner residencies in rural communities a really vital part of rural practice, and an opportunity for some of our listeners to consider how a rural nurse practitioner residency may be in their future. And I am very grateful for your time today to inform our listeners, and thank you to our listeners for being part of this episode.
Thanks for listening to today's episode. You can find the links to Rural Prep, Bassett Healthcare Network, and Presbyterian in the episode description. You can also find North Dakota State University's Advanced Nursing Education Nurse Practitioner Residency Program on Twitter, Instagram, and Facebook. Lastly, you know where to find the Nurse Practitioner Journal on Instagram, Twitter, Facebook, and LinkedIn. Please also be sure to give the podcast a rating if you liked today's episode, and thanks for listening.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Walters Kluwer. Please note that the hosts of the Nurse Practitioner Podcast are not clinicians. However, we created the Nurse Practitioner Podcast to bring you relevant clinical information by NPs for NPs. Thanks for listening.